started to look at the collaboration between housing agencies and the Workforce Development Board, or workforce support services that go on, education services. So that's where the idea, I think, for the HWIN meetings came from. Maureen, you can jump in and correct me on that. But we see a lot of co-enrollment between resources and services. A lot of referrals take place. Those referrals for our participants or our clients happen more easily when the workers collaborate with each other, when we can make warm handoffs, when we can link services together. So today, that's kind of the conversation we wanted to have. Jamie posted the agenda. So some of the topics, we kind of came up with talking points about problem solving related to collaborative case management. You know, what does the collaboration look like with your agencies? What works, what doesn't work, what are the challenges, and what changes could be made. So we're going to do that in small groups. Jamie's going to put up, I think, a Jamboard for us. Then we're going to collaborate and share information and just kind of go from there. Did you want to put any input in, Maureen?
Okay, yes, sorry. I always have to find my mute button. So I'm thinking of the past where this kind of collaboration was wanted by the group, and they decided to do take some practical steps, like let's create a referral form that would kind of travel with the person being referred. So to ensure that warm handoff, that you're not just, being given an address or a phone number, an email address, but I, the referring person, am going to connect with the receiving person and say, hey, look, I am referring this person to you. I'm going to email the referral form and all that, and you'll have their background and details to the extent that the referred person feels comfortable sharing. So there's that form. And the thing that was so helpful about having something concrete about it is that it felt kind of like official, and I think was, from the client perspective, they felt like, oh, this is a real process that's in place, that I can trust this, not just, these are agencies who may not even talk to each other. And it was helpful for the receiving person to have just some basics to start the conversation. And then the other thing was, having that form and an associated tracker helped us keep track of, how did that referral go? Was there a success there? Did that person, get a job or get housing, or, what happened? So kind of the follow-up and is more needed later. So we could see the results of our success, and we started to gather numbers. That was really good. So, we don't have the power to create the master database that is like one big homeless and workforce services thing, but we can do something like this that would facilitate those direct linkages. And I use that phrase because it's written into the WIOA regulations, to make sure those connections are happening with integrity and quality, for the best possible outcome for our shared clients, and for each other as colleagues.
Great. And I work with a lot of clients. I work for Hope Solutions, so it's a housing program. Primarily, that's the focus of our agency, but we also do supportive services with, helping people find employment and other resources, education resources. And I know personally from working with clients, it goes a lot better if I can tell them about the other agency I'm referring them to. If I know someone there, if I can highlight how it benefits them, what the outcomes, and how it worked for other clients as well. There's a little more, and more knowledge makes people more comfortable, more understanding. Did anybody have any questions? Or I think we're going to move into kind of small groups, and we're going to utilize the talking points in the agenda to discuss this. Maureen?
Yeah. I had a question just because I'm seeing in the chat, there's an example of something that maybe didn't go well, or the person wasn't sure if it actually happened. And so what can we as a group do to solve those problems or to positively influence those situations where we're not sure the connection has made? Now, is that something we want to discuss on Jamboard? Is that something where, we need subject matter expert to say like, oh, well, here's the process, how you can run around and check up?
Is there any way that we can look into a process of closing the loop? I know that's what we have internally at school, is when I'm like resolving my referral, I have the option to, let them know what my resolution is. And sometimes I won't be very specific because privacy, but
Right.
I will let them know that I talked to the student and, we've dealt with it.
This is Jamie. It looks like the challenge you were having was like specifically related to homeless services, not necessarily homeless workforce. Is that right? So we can definitely talk more offline, but I think there are probably ways, especially if you're like a staff person that frequently refers people, as you said, like there are these challenges about not being able to release a lot of information, but usually what we can disclose is like either we did or did not make contact with that person. Like we can usually provide that much information. And I saw Mike Callanan here. I don't know if that's actually Mike, but if somebody from it often sort of comes up around CORE, right? Like we tried to connect them to CORE. We don't really know what happened if the person doesn't have a phone. So, maybe I just in the interest of like keeping the focus on workforce and homeless services, happy to talk to you after that and do some troubleshooting internally. But I think what you're bringing up is that's happening with the homeless services, but also like what happens if you're referring somebody to workforce? Like are
Yes.
there ways to officially close those loops while being mindful? Because like we were talking about this before the meeting started, could we have a big database? And I'm like, yeah, but there's privacy concerns with that, right? Like we're restricted with HMIS. We can't share information about clients in a non-secure place. But are there other ways where it's not tracked necessarily in a database, but there are case conferences or conversations or this question of like, how do you close the loop and make sure that you know what's happening? So I think you're right on the right track of what we're trying to figure out today.
Yeah, clients can sign releases.
But I actually find that a big issue, Jamie. If we go back to, there's kind of a map of how homeless services interact. And we were looking at how homeless services interact, and then workforce services and education are out here on the edge. And to speak to Hope's question, I get contacted frequently by education programs like Contra Costa College, DVC, people that work at the adult schools, because I've contacted them in a workforce facility and they know I work for a housing agency, to find out how can you help my student who's homeless and struggling like this? And I get that question so often. I have a set email that I send to people. I'm like, this is what you do. This is what you say when you talk to 211. It's hard for me as well, because basically, my agency says they need to go through 211. That's the central area. And 211 does a lot, but it feels very, it doesn't feel like enough from my point of view. Because like Hope, I don't know what happens after I tell them that, are they getting that entry point? More often than not, Hope, personally, I suggest people go in person to one of the 4 entry points.
I'm dealing with a lot of folks who don't have cars. And so that's been my no car, no phone. I'm like, I can give you a Clipper card.
Yeah.
That's a real challenge. I think there are some challenges relating to that communication piece that are like above my pay grade, sort of around like HMIS and restrictions around that. But it would be curious. I'm going to try and see if we can get Mary Fitzgerald, who's our coordinated entry manager, if she can come to one of these to speak to some of that, because there is, as you said, Morgan, like if you're working within homeless services, but also employment, and because there's these restrictions, like what are the possibilities within the homeless side of things? And I don't know what restrictions you guys have on the employment side of things. I'm guessing it's maybe a little less stringent, but I don't know. I'm gonna ping Mary right now and see if she's good.
Yeah, that would be great, just to hear the other side of it. Joe, did you want to add something to the conversation? You have your hand up.
Yeah, for sure. Thank you. This is Joe Bruno, peer support specialist with Delta Peers, and I'm coming from like the community side of things. I'm coming from that lived experience side of things, where I'm the one that, you know, didn't have the phone. I'm the one that couldn't get resources. Like I'm that person that you're all talking about. And I'm curious on this idea behind, we have to meet them where they are, right? We like, you're all supposed to meet me where I'm at. But what does it mean to bring the system to them? If they can't utilize the system, if I'm not able to use the system because I don't have a phone, then how do we bring the system to them? What is like, does that look like more access points? Does that look like more resource centers? Does that look like more wellness? Like what is bringing the system to them look like? That is currently where I'm at with this conversation with 211 and the bottleneck and the everything else that we're discussing. So I'm curious on how do we bring the system to them if they can't come to the system?
So, Joe, I'm sorry, you work with the Spirit program?
Yes, valedictorian 2021. Woo, woo. Yeah, thank you. Yeah.
So, I mean, you know, talking about more access points, how do we collaborate access points with the education services? Is that?
Oh yeah, I think that is brilliant. I think that's absolutely brilliant. Especially because there's also staff that are experiencing homelessness, faculty
Yeah.
who are experiencing homelessness. So, you know, so absolutely. What's that look like? I don't know.
Yeah, what does that look like? Because we do, I mean, all right, so I'm gonna say this, or there's, but I can't remember what the document is. I bet Jamie could help me out. There's kind of, or Maureen, there's a list of like entry points into services, whether it's workforce services or homeless services, there's these entry points,
Yeah, we call them access points. So
access points.
they're not comprehensive career centers, but they're places that provide on-ramps into the system.
And is that something that helps with getting connected to CORE or to?
For homeless services, they have the care centers you can go to, your care service centers or warming centers. We're the access point, and CORE is the access point for the warming centers. And we do warm handoffs with their staff at the shelters also. Like when we put somebody into shelter or Delta Landing or Very Mission, we usually try to take them and do a warm handoff into their system. Things like that. And
Yeah,
Trinity Center is like one of their access points. Care Center at Concord is access point. GRIP is an access point.
Yeah, thank you, Mike. I actually dropped in the chat so that for homeless services, the 3 access points are 211. And through 211, people can access prevention. There's a screening that happens. They could also potentially get connected to CORE, which is our mobile outreach. And then we have 2 care centers. So one in Walnut Creek, one in Richmond, where people can come in, have a housing assessment, in addition to like showers and food and that sort of thing. So ideally from those 3 points, people should be getting assessed for all the different things they need, which may include workforce. What happens when that's identified though is sort of the question, right? Like if we're calling 211, it's like, okay, here are the 3 whatever to call, but 211 is not necessarily doing a warm handoff. CORE and care centers are more likely to be doing warm handoffs. I don't know if that answers that question, but.
Antoinette, you've had your hand up. Go ahead and jump in.
Thank you so much. I kind of wanted to respond to Joe with her initial comment. So part of the Shelter Inc. mission is assisting individuals, one family, one individual at a time. And so with that, with employment services and HVRP, dealing with the individual is definitely meeting them where they are. So for my team, we're working with individuals and maybe they don't know how to utilize a computer to apply for a position. We can take our laptops to that individual. If they don't have a car where they can get somewhere, we'll meet them at the Starbucks or, you know, whatever is convenient for them. It's not so much about, oh, you've got to come here to receive our services. We have services and we will bring them to you. We will work with you. And I think it's so important to have a network of resources so that when I can't or my team can't assist individuals with something specific, that we can tag team with someone else, the warm handoff. But in doing that warm handoff, inviting that other entity to, again, meet the participant where they are. So that's kind of the approach I'm taking with my team.
This is great. And I wonder, like, is there a way to get how, because if it works, if it is working, like, how do we get that into the bigger picture? How do we get that policy and the way that it works into, I don't know, that's a policy thing. And I'm probably on another high horse that I shouldn't be on, but I'm thinking policy change. Like, how can we get that process? If it works, then how do we use it for other departments and other organizations and other streamlining that connection? I think that's great.
So I'm going to say individually, we just make it happen. And I know that that's not creating the policy per se, but it is creating the unwritten process.
I wonder if for, you know, because all the organizations have different rules, regulations, and things they have to follow. And I wonder if one of the things is we can try to coordinate between those of us who are able to kind of go out a little bit more versus those of us who aren't, and coordinate to have those warm connections when we are kind of out of options ourselves. I love that, Joe.
Yeah, these are great conversations, and I'm thinking about what Antoinette said, and you know, Hope Solutions does a lot of the same thing that Antoinette's talking about. You know, our case managers and myself, our employment support staff, are going to our clients. If you don't have a phone, if you don't have transportation, we're finding a way to meet our clients where they need us. And so there's very little barrier as far as that comes, but getting the client or the student that's in the midst of experiencing this initial crisis, getting it into a program like Shelter Inc. or getting that person into a program like Hope Solutions is, I think, where the challenge sometimes falls. Perhaps that's what.
I just want to flag that Mary, who's the coordinated entry manager for homeless services, arrived. Hi, Mary. Thank you for jumping in. I don't know if anybody wants to recap kind of where we were having.
Do you want to ask your question, Hope? Because it started the discussion.
Absolutely. And I'm going to kind of just copy and paste the message since you just entered, but I shared in the chat that I had a kind of difficult day yesterday, really difficult, where I had someone come to the college who wasn't a student. And I, to this day, can't figure out if he wanted to become a student, but he wanted support and needed help. And he didn't have a car, he didn't have a phone, and he was definitely in some mental distress. And I really, really struggled to help him and support him. And I did get eventually to somebody named David at CORE, but I don't know if the intake happened. I did get him a phone for $25 from Walmart, payphone, but and I know that there is a Cal Lifeline if I get him on CalFresh, and I had him fill out that application. But there are only so many things I can do as within the college realm, especially if they aren't applied or a student yet. And so I was really trying to kind of get him to the right services, but without, like, CORE was what I was really kind of hoping for, but it just didn't work out for me that day. But I also know that, you know, again, we only have limited resources.
And one of the things, Mary, that we were talking about too, sort of related to that, but other people were expressing this too, is sort of this idea of like, how do, like, so say, you know, these are all folks that are maybe referring people, but then there's like no real way to close the loop. Like, what are the best ways for people to close the loop if they're referring folks to homeless services? Like, our process is maybe a little more restricted than, say, employment. Like, if we're like, hey, we refer somebody to an employment program, we can check in and kind of find out where they are in the process, but that doesn't always work when people are like, so I called CORE, can you, like, what's happening with them? I'm saying, like, we mostly can say we either did or didn't make contact, but can't really share beyond that if you're not on a, you know, don't have a release of information. Wondering if you have any, I mean, not to put you on the spot, but thoughts about like this whole conversation today is sort of around like case conferencing between homeless services and workforce. But and as part of that, figuring out like how do we tighten things up so that the communication is better between our two worlds, and are there ways to be able to follow up if a referral is made, if you're not, so like Hope, for example, like they're not in HMIS, so like what's the best way for people to find out what happened with somebody, assuming, so like Hope, right, you don't have a phone number for this person, you might not ever see them again. You know,
I just spent 8 hours of my day with them, but I have no idea what will happen.
right.
Thank you for bringing this up. I think it definitely depends on the situation. So originally, Jamie, when you pinged me to join the chat, you had mentioned like questions around case conferencing and data sharing, etc. So for providers that are in HMIS providing services, our HMIS ROI does cover all of us and all of the providers within HMIS, in which case, in this type of situation, which Hope is describing, you would be able to reach out to the entity that you made the referral to or tried to connect them to, and you would be able to ask and say like, hey, you know, we tried to connect this person, just want to see if you made contact or if there's any support I can provide, et cetera, because anyone in HMIS is covered under that ROI. As far as situations kind of Hope with what you're describing as someone who's working with folks experiencing homelessness, but not necessarily in HMIS, it's a little trickier because basically you can kind of do your best to make that warm handoff and make that connection, but CORE, or it could be a care center or a shelter or wherever, you know, you attempted to connect the person 211, you know, they wouldn't have that release of information to be able to disclose kind of and report back to you whatever came of that situation without the explicit permission from the person beforehand. So I think that definitely can, you know, as you're experiencing, present a challenge. In your case, it's hard, like you said, because you don't know if you'll ever see this person again. So I really am not sure how you would be able to follow up because, you know, you're not covered under this ROI where you would be able to send a message, for example, to CORE and say, hey, like, was working with this person, sent them to you guys. Were you guys able to make contact? Any help I can provide, let me know. Ideally, like outside of that type of situation, you could follow up directly with that participant. Like next time, say you see him again, hey, you can ask him, you can ask the participant, were you able to connect? You know, if not, can I help you connect further? Let's call them together, or let's go to the care center together, things like that, and just follow up with them. So in your case, like if you're sending folks over, the best way that you can follow up is really speaking directly with that participant and seeing how it went. And, you know, like I said, you could try to call again together or stop by care centers together, etc. Yeah, hopefully that kind of answers the question. I can definitely see how it presents a challenge when you're not kind of covered under this ROI to coordinate with folks.
So
Go ahead, Morgan.
Sorry. I wonder, I'm just thinking, so your focus is kind of on the follow-up, but I'm also thinking some of the issues that we talked about before you jumped on, Mary, are, the colleges and the adult schools frequently have questions about how to connect their homeless students or students who are in fear of homelessness or struggling with housing services. Like, I've gotten that direct question myself. And I'm sure it seems like, well, we have the core access centers, we've distributed that information, but why is it that education programs are still asking how to support their clients or people that come in? Is there, because I mean, that information goes out a lot about the core centers, about 211, about the 3 main access points. And I think someone put in the chat, would it be good for there to be like a specific core person connected to the schools, that someone that works at a school, at a college or an adult school would have, Joe so-and-so works at core. So if we have a student that comes in, we could call Joe.
I mean, I do.
Or is that too much?
Yeah.
Go ahead, ma'am.
Okay, so I can't necessarily speak to, maybe why. I think sometimes maybe there's a change in staff sometimes at the colleges, that maybe they have a staff that knows, oh, if I have a student needing these services, this is how we're connecting them. That could be one thing, but I know definitely, I think we do our best to make sure, and Jamie and like community engagement folks do their best to make sure that those entities are aware of our access points. I think it's also helpful for everyone to know that there are services that go through these access points and coordinated entry, but there are also, housing services outside of that too. There's a lot of new resources for folks who are receiving like Contra Costa, that are members of Contra Costa Health Plan. There's a lot of different ways. So just I find, like, for example, the 211 database a great place to search up various resources in the area. As far as I see a lot of stuff in the chat regarding core. I do see we have we have the core program manager online, so I want to make sure we give him space to talk, Mike. But what I will say is that the core teams are kind of strategically placed based on different like city contracts and places where folks are specifically wanting to have like core teams. And I think the core team grows in expansion and tries to cover as many areas as possible. But core in itself is an access point. So, I think that they cover a lot of ground. And I'm not sure, if there were to be like a core team specifically at a certain site, that's kind of something that a conversation that would happen between that team and potentially like whatever college campus it is that is seeing that as a concern. But Mike, I don't know if you want to add anything regarding folks being able to connect with core, or any advice for folks having trouble connecting.
They would call the 211 and hit option 3. And then they would ask for the TAY team, which is their transitional aids use team. They work from 18 to 24. So, and then that team can go and connect with them. And if it's a case manager, they could put their number, or if it's a person, if they have a contact number, we can get them directly connected with them. If it depends on like with the time you're going to be with them, because sometimes we might be able to get in contact with them in a few minutes. Sometimes it might take a day or so, depending on what our schedule, how busy the team is. Yeah.
Yeah, and I guess one of the questions I'm having is the issue that people don't know or can't reach out to those access points, or once they do, the services that they want or need are not available? Because those are two different things. And I like, as the communications person for our system, like, I'm always curious to know, is it that people don't even know how to start, or is it that we don't have enough resource in our system? And so what's happening is they're doing all the right things, but they're still not getting their needs met because we don't have enough resource in our system. And I mean, I'm sure the answer is probably both.
Who is the question for, Jamie?
I mean, I think the providers in the group that are saying like, you know, I'm referring folks and they aren't getting what they need. I think, and so my related question is like, are you seeing that same thing for homeless service providers? Are you seeing that same thing when you're referring people for employment services? Like, is it that people don't know, or it's that there is not enough? Yeah, so hope, yeah, I mean, I think that's just a capacity issue, and that's really frustrating. You're doing what we're saying to do, which is all 211, reach out to CORE. And there's not enough CORE to go around. And the other thing is like, once you do get to CORE, what they have to offer is actually very limited, right? Like there's not very many shelter beds. They don't have like apartments that they can offer. So I'll just do a quick plug as a side note, we're working on some communication stuff to help people set realistic expectations about what might happen once they do all the things we're telling them to do. Because it's frustrating.
Yeah. I would just want to really quick piggyback on Jamie, what you mentioned about expectation. I think that kind of helping folks that you're assisting in connecting the service, setting their expectations that you know, the assistance, it's not necessarily something that is going to happen the same day. Sometimes there's like emergency situations, domestic violence. Sometimes if there's like someone extremely high vulnerability and there happens to be like a shelter opening, there might be that immediate connection. CORE is also able to be dispatched to location to try to provide some basic needs. But I do want to mention that a lot of times it's reaching out, engaging with our access points, and then following up as folks are connected, matched to the resources that are available as they come up. And so I think, you know, setting realistic expectations with your folks you're connecting. And I also do want to highlight that CORE, you know, it is pretty much the most commonly talked about access point, but we do have 2 care centers that folks can drop into. I know we don't have one in East County, and it's probably hard for some folks to make it out to a care center, but we do have our care center, Trinity Center in Walnut Creek, as well as Griff in Richmond. And these are care centers that folks can walk into during business hours and get their basic needs met. So they'd be able to get a hot meal, shower, do laundry, and if they would like to receive case management, get connected that way. So that's a great resource that's available too, to emphasize if you're having folks having trouble for whatever reason getting connected with CORE in the way that they're hoping. And those care centers are access points. So folks are coming into care centers and getting assessed and placed kind of in our community queue, and the case managers there are trying to connect them to the available resources. And I think, Hope, I cut you off, so go ahead.
Oh, no, I was going to say, I mostly was going to apologize for completely diverting workforce today and ask a workforce question. Mostly I have a student and I've given him a job, but I can't get him here to campus. He lives in Alameda, in Hayward, and his car got repossessed. Well, he's facing an eviction, so I'm trying to get him moved closer. But in the interim, I'm wondering if anybody has any resources related to that could help.
Sure. So for something like that, like one thing I'll say is each kind of like coordinated entry entity or our access points, we look specifically at serving those in our area. So in Contra Costa, so I think there was a mention about vans, or sometimes we'll dispatch vans to provide transportation to folks, although that's generally like within Contra Costa County limits. But for someone that you have in Alameda, I would say definitely connecting to the access points in Alameda. And also, like I know for him, if he's at risk of eviction, that would be falling into like this prevention category. So I think they have a prevention hub out in Alameda.
I've tried.
Really?
That one I am beyond on. My goal here is to get him a safe place here or in Berkeley. I've had him apply for all the affordable housing options. Right now, I'm just trying to get him a job and get him to school. He's on the football team, I'm just trying to help him out.
Yeah. And I think one thing that's kind of from this example that you just mentioned that I'm taking is that it's important to note, like, the situation of your participant that you're trying to connect will definitely, that will kind of speak to which resources or teams that they should be reaching out to or that they get connected to. So CORE specifically serves unsheltered folks experiencing homelessness or people experiencing unsheltered homelessness.
Yes, and I apologize, Mary. I switched over topics.
No worries. Okay. So I think that's kind of maybe sometimes can be a confusion if someone's like, oh, well, I've been calling CORE asking for this. And maybe it's like, okay, well, maybe CORE can't help you because they focus on unsheltered folks experiencing unsheltered homelessness versus this other option in 211 if you need your help with back rent, you're talking directly with them. So examples like that, I think Jamie is kind of working on better communications to clarify, again, what people can expect when trying to connect.
So I wanted to give, somebody had their hand up for a while. Did she disappear?
It was Vanessa.
I'm
Vanessa.
still here. I'm sorry. I just, Mary mentioned something about case managers at GRIP, and I work closely with the residents from the Castro encampment, and which is curious, would they qualify for any of that case management services, more particularly those that are in temporary housing while we're trying to find permanent housing for them?
So GRIP operates a care center, which is an access point where folks can come in, get their basic needs met, get connected and intake into our system. I believe with the folks for Castro, they're already enrolled in other programs that they should be getting case management from, in which case we generally don't overlap or duplicate services. So usually if folks are coming into GRIP Care Center, it's kind of like as that first stop for them. In which case, yes, they would be able to receive case management. However, I think if you're referencing folks specifically in Castro, from what I understand, I think there's like other areas that they would be getting case management services from, and they're in other programs already.
Okay, thank you. So then my follow-up question is there any way that we as a team can get access to who the case managers are so that we can communicate to kind of help them? Because I was in a meeting earlier this week and it was identified that some of the residents have case managers, but they're unaware that they have case managers. So there's that gap again, right? And I want to make for sure as the project manager that if they have a case manager, which is very severe and needed at this time, that we're making the necessary connections with those case managers.
I think in that case, I know you guys work really closely with the Richmond core team, like with Robert and stuff. So I think you would be able to ask him like, hey, is this person in any other program providing case management? If so, can you connect us? Because he would be able to possibly tell who that is. Yeah. Jamie.
Hi, Jamie.
Let you
Um,
back take over.
Actually,
I
okay,
do
so
not
Mary,
want
my question is actually for you, and I know that we work on the same team, but I realize there's a layer that I don't know. So say we have, a homeless case manager or service provider is working with somebody, they refer them to an employment program. Are those always like warm handoffs, or is it like, I'm just curious, like how those relationships are getting set up from the perspective of homeless services, initiating, connecting somebody with employment. Do you know? Or is this not even an issue? Like you guys all know how it works already. I'm just curious.
And you said that was a question for me, right?
Yeah, I think.
Or for everyone. Well, I'll say like in terms of the programs and services that coordinated entry will connect folks to, when that referral is made, the receiving program can see like what the person's current program and the referring case manager. So ideally, I think if it's like supportive housing, wraparound housing, we always say and it's on our screening tool, this is who the case manager is, like, please connect with each other to be able to work with that participant together. If it's a program kind of outside of that and like our specific system where we're making referrals, I'm not sure, but ideally when you have like a referring case manager, everyone is getting connected no matter like, you know, the program type. But I know in terms of the programs we refer to, yes, we do make that connection or introduction. I'm not sure if anyone can speak to like other experiences.
So I think some of that is kind of what we were, you know, talking about as far as case collaboration, Jamie. You know, I work in rapid rehousing. So we get the referrals, you know, through CalWorks and H3, work with Mary. And then we have case management, we have internal employment support services, but we often refer out to other services such as SparkPoint, make referrals out to Rubicon programs, you know, Rubicon being specifically employment focused, where ours is, you know, our employment services are a support for the housing program. So with those services, at least for myself, and people can totally jump in, the best outcome is that direct handoff. So for myself, getting to go and visit people at SparkPoint and getting to know representatives there and people whose phone number I have, email, and I can call them and talk about a specific client. You know, we're not going into health information or violating HIPAA in that course, but referring someone over there and working together and exchanging feedback in that way. So I think that's kind of what we were looking at, is that one-on-one connection works best, as opposed to just saying, here's a number for SparkPoint, you should really talk to them, they're great.
That's great.
I'm sorry, can you say that again?
Which part?
Can you rephrase what you were asking?
You, Jamie, rephrase your question and Capri will
Oh,
answer it for her
me?
agency, I think.
Oh, it was just about like how, from the homeless services side of things, how are people getting referred to employment? And is it like a warm handoff? Is it just like a referral in HMIS? Like is it a different process for every agency or every kind of staffer? I actually just don't know.
Okay, so for employment services with Shelter Inc., we do provide 2 forms of employment assistance. That is through our HVRP program, that is for our veterans particularly. And then we have employment services, which is for our internal housing programs. Now we do offer workshops, resume assistance, and things like that with our community partners at the AJC. So we work closely with EDD to kind of provide services, employment services for our external individuals that we come in contact with. When it comes to housing referrals, we refer them to 211. And in the chat, as you can see, I indicated in regards to participants or external individuals that are referred to Shelter Inc. for housing services, we refer them to 211 as the starting point to go through that coordinated entry, but they tend to kind of come back to us. So it's like a circle that they go into, but we provide and offer service to external individuals, internal individuals, and our veterans particularly. Did that answer your question?
It did. And I wanted to add, so we've created a Jamboard if people like feel like they want to put questions or some information about how your agencies are doing this. If you haven't used Jamboard before, I'm just going to show you super quickly.
Okay.
Okay. If you click on that link, you should come up to a page that looks like this. And over here on the left-hand side, there's a little thing that says sticky note. You click there. Sticky note. I can't type.
I don't have that toolbar on the left.
That's weird. Is anybody else having that problem? Let me just make sure.
We don't
Oh,
have
your
edit
viewer.
access.
Oh, I know why, because it was, sorry. It was as viewer. Okay, now try it. That's fine.
Lost my chat.
Let me just. hold
Me
on.
too.
Okay, so let me just put it back in here. So now let's try it again.
Oh, now I have
Is it
it.
working?
Thank you.
Okay, great. Great. I'm gonna stop sharing. So see that? All right, I'm turning back up to you, Morgan.
Yeah, it's a lot of information. That was an amazing. I think we could utilize the Jamboard to put some of those questions on to kind of look at later, the questions about, because workforce services encompasses education programs, community colleges, adult education. So the connection with that and the homeless services is what we're looking at closing the loop or finding better collaboration. So if you want to, add some of that, we have it in the chat. We can definitely transfer it over later to think about and discuss. But we've got about half an hour left. This might be a good time to kind of look at our collaborative case management ideas. And, what are the challenges with the collaboration? How does it work for you? Where are you seeing real life examples of collaborative case management or co-enrollment between programs? I think Betty put in the chat a direct phone number for a representative at the Richmond Spark Point office. And that's kind of like the example I was using when I have a direct phone number, a person that I actually know to call and connect my client with and explain, because somebody's taken the time to educate me on exactly what the process looks at. I can tell my clients, this is what's going to happen. They're going to do this orientation, then you're going to do A, B, C, and D. It takes off that pressure of stepping out to something new, and I can give more encouragement and advice on how to navigate it and take advantage of it. So the kind of talking points we looked at, what does a warm handoff direct linkage look like for your agency?
What happened to the previous thing that said about referrals? Like that's gone. I created a post-it to go on a different page, but when I put it down, it went on this challenge and resources.
I just changed the name of this page,
Oh,
but
okay,
I haven't deleted any of the post-its.
okay,
So I had initially set it up as group 1, 2, and 3, but I feel like we can just be on this.
okay.
We can just do it all together. So what are the challenges and resources for collaboration that you found? And you can put out ideas for what you think would work better, having a van that goes out to the sites, or having a person in core services that you would think would help. What are your ideas?
Can you say more about what kind of collaboration you're thinking of? You said just 2 examples there, but what are we looking for as far as what kind of collaboration?
Well, good question. Now you're making me think. So collaboration between 2 agencies. So say you work at the community college and you're looking for workforce support services for one of your clients. Say that you're a housing agency and one of your clients is looking for trade school support services, financial support services to get to interviews, financial services. Think about the other agencies, I guess, that you interact with. Maybe Jamie or Maureen could explain it better. I'm struggling.
That totally made sense, though. I mean,
Did it?
even
Okay,
in- yeah,
thank
I
you
was gonna
so
say,
much
even
for
in your
that
struggle, if you
positive.
felt like you were struggling, it made sense to me. It made it make sense. So no, we're good.
Okay. Also something I struggle with, like re-entry services for some of my clients.
Well, and somebody can put this in the jam board for me, but I'm thinking like again, coming from that lived experience perspective, like being homeless for as long as I was, and even still now borderline kind of like, it may not be HUD definite, but I have a roof over my head, but I still don't have residency. I don't have I have one place that I can send my mail to, and the only mail she allows me to send is anything that has to do with my social security. Any other mail I don't receive. And I know I can get options. My mail can be sent to this place, that place, whatever. But again, transportation, getting it, trusting their folks. With that said, collaboration, where I sit, I'm trying to collaborate as like what's difficult is getting folks in the system to trust me when I'm currently one of the people they're trying to help, right? Like, so I don't know that part. That's where I'm struggling. Just
Mhm.
because I may be using the resources because I'm homeless and I'm trying to find new work and I'm building this and whatever for myself, it still seems as if I'm not getting anywhere because the systemic red tape around all of it.
Mhm. Yeah, I think there's challenges also. I think there's challenges being a housing agency for me, working with clients, and I think a lot of our clients feel like everything we do is contingent on their housing. So there is trust issues to be built there too. And I wonder, Joe, you could speak to this, but one of the issues that we've discussed kind of offline a lot is anytime you get referred to a new resource, you kind of have to fill out a lot of paperwork all over again and do an assessment all over again.
Can I say how much I wish that there was a collaboration between departments and like the information that there's no reason why the behavioral health and the Medi-Cal and like they should all have my information. There's no reason why we need to be doing this. Like it's re-traumatizing. Yeah, the intake process can that be streamlined somehow?
I wish, we wish.
Right.
I think it's incredibly challenging to help people and continue to help people and continue to try to, serve the community when you yourself are trying to get on that lifeboat. And it's a hard lifeboat to get on sometimes. I know I'm also kind of experiencing that just because my housing situation is unstable. And I know that it can, I don't have the safety nets that I wish I did. So I'm just emphasizing because I do understand how it can feel like all the red tape and bureaucracy is just getting in the way. I don't have a solution, but I just want to say I emphasize.
And I mean, kudos for you sharing that because I can't even imagine being in a position like a system worker and working full time and then still trying to battle like where am I going to live? Like kudos to you. High five from virtual window to window.
Was there talk ever, I don't remember, if there was ever talk about doing like monthly or quarterly case conferencing, like to like basically something like this where people would come. I mean, I don't know, again, I don't know about like the data sharing, how that works. I'm just thinking about how we've done it in homeless services where you pull all the providers together and they talk about their clients, but everybody has the same permissions. So I don't know how that works. But
feel
you
like we should
basically
be able
go
to
down
do
the
that
line.
anonymously. And honestly, that's kind of what I feel like I need at this point because I don't. Yeah.
Like I'm having this issue, I don't know what to do versus like, did Bobby Jones get
Exactly.
blah, blah, blah.
So Hope, what do you feel like in your role? Because you work at Contra Costa Community College, right? What do you feel like in your role, your connection is with homeless services throughout Contra Costa County?
Jamie, she's my connection. And she's given me some great resources. I am just, you know, I utilize the services as I've been trained through the 211 training. They're just unfortunately not working for my students, because many of them don't drive, so they can't go to the care resources, and I can't access 211.
So when you started working at the college, was there established processes?
No.
for that
There
stuff?
was one wellness coordinator before me. She was burnt out. We have one therapist. She just quit because she got burnt out. We use the Wright Institute to bring counselors in twice a week. So that's where we are with counseling, and I have a telehealth app that I use to give them some healthcare and some mental health support. But that's it.
So that seems like a, challenge. to
Basic needs is a
understate it.
new department. And I think that it is absorbing a lot of what every college didn't have already. So I know a lot of colleges have a health center, and so the health center is able to absorb a lot. We do not have any type of health center on campus or crisis center or anything like that. So one of my big goals is definitely to, kind of work on the building up here. And I've gotten a second person here to help me now. And we're working to, do more hiring. But right now it is really rough. I'm not going to lie, but I don't want to be one of those people who burn out or turnover, because I love this and I see the need, and I really want to make that difference if I can. I really like this area and the people here, and you all have been amazing. And I know that there's so much that we can do. It's going to take time. Jamie.
Well, I'm curious, as you were saying, like, you don't have a health clinic, do any of the Contrast Health mobile vans come to your site? Part of what I've envisioned for years and years is sort of like these pop-up events, but that happen at the same place, the same day of the month or whatever, with like folks from reentry and folks from employment and like White Pony
And it
Express.
should be easy because
Right.
we already have these huge events once a month, once a quarter. And so I have Cal Fresh coming to our welcome week, for example. I think Caroline and I were speaking about the mobile health, but my understanding is that they have to use Medi-Cal insurance, and that was where we were getting the hold up there.
Got it. Okay.
But that is kind of the goal, kind of some of what trying to get there towards.
Because I'm just wondering about that. The thing I always come back to is our county is so huge.
Yes.
And the transportation issue is so real. And brick and mortar sites are so hard to get off the ground. Like, we've just been trying to get an East County Care Center for the entire time that I've been in homeless service, which is like 8 years. But thinking also like not just health, not just basic needs, but also employment, reentry, all of these things, I don't know. That's my dream. But wondering if that also would like help sort of, you're face to face and you're like, okay, so here's the employment staffer, and I'm going to connect you right now to so-and-so from homeless service, like the core team member that is at this event, and everybody builds the relationships that way.
Yes, even if I could have folks like here once a month, and I can tell my students, they're all going to be here on this day, I think that could make a difference. A lot of them are transitional age youth as well, and we all know the extra challenges that come with trying to get them to go anywhere or do anything. But I do want to say again, I apologize, kind of like I know it's workforce, but also kind of we've just kind of go full on. So I just want to appreciate all the conversations and advice and suggestions all of you have thrown my way.
Yeah, I think it's been a great conversation starter, Hope. You really started us on an amazing path, because this is where it all comes from. And I've been doing employment services with Hope Solutions for 3 years, and I've we didn't have an employment department before I started, and step by step, person by person, I've built these connections. And that's what's made me feel successful, or, you know, being able to more successfully support clients. But it takes a long time. And if you're doing it person by person, what happens, you know, when I quit? How do I pass that all on to the next person? Where is that established kind of policy? And I think that's what comes from having, you know, either a database, a direct person that you link with, and then updating it when they leave, you know, okay, this is my person here, this is my person there.
Succession planning definitely seems like something in these realms we all need to be maybe focusing on a little bit.
Mhm. Hi, Joe, I see your hand.
Yeah, I was just going to jump in, but I thought I would raise my hand. This conversation really reminds me of what Delta Peers has called the Constitution of Intent. And one of the things that we have been trying to do around this whole policy change and building that hope into the system is making a peer navigation to where there is a peer, a specific, could be a core member, whatever that looks like there's a specific group of folks who will walk side by side between you and the person that you're helping. Like, it's a navigation to where I've used the system enough times that I can help somebody else through the system, but then you guys as a system worker have access that I don't have access to. So to work peer to peer, somebody like me is a peer to a system worker. Somebody like me is a peer to somebody using the system. So there's a niche for a peer navigation system. And this conversation is exactly the policy that we're trying to build, I think, is building that hope. It's that hope policy that the actual system denies. So yeah, yay us for being, I love Contra Costa County. This is great.
That's amazing. That's amazing with the peer navigation and the Constitution of Intent. I like that, Joe. I think that's a great way to do it because it's so hard to navigate all of these resources. I see my clients trying to navigate Housing Works benefits, CalFresh benefits, welfare to work benefits. And it is hard. I've sat on the phone with my clients for hours trying to talk to people and get guidance. And it is so challenging. So we've got about 20 minutes left. I'm thinking we were going to talk about one thing that we did try and create out of the HWIN meetings is a central, what is it, like an address book, Jamie? Where it has all of our information, phone numbers, names.
Let's see if I can find it.
And that's something that's good to have. You know, Hope, you should add your name to it and download it to your computer. Everybody else, it's a shared Google document. And it has people's names, what they do, where they work, their email address, their phone number. If you haven't put your information on there, put your information on it, please share it. It gives us a way to connect with each other and reach out for assistance.
Let me know if for some reason that link doesn't work. I just want to make sure the permissions are set right.
I also wanted to flag that I dropped the Constitution of Intent link into the chat. It'll take you to my personal website, but it'll give you detail about what I was referring to.
Thank you so much.
Yeah, happy reading. It's pretty amazing.
So the link works, Jamie. And I'm going to pull up Joe's link to look at later. Thanks so much for sharing it, Delta Peers Annual. This is great. This is such great information. So Maureen, I have on the agenda that you want to discuss review
Field
database.
Oh, yes. I can
Or
pull it
field
up.
trips. Yeah, either one.
I'm just sharing the database so people can see.
Okay, yeah,
Let me
I just,
actually sort this by alphabetical. Oops. Okay, I'm gonna wait to sort it 'cause people are in there.
yeah, I think I just wanted to remind people that this exists, and then I just put out the suggestion to maybe have the link on every agenda. Because there's always new people coming, and sometimes we forget it's there to use as a resource. And what information it has, services and how to refer, and contacts, some real names of real people. So that's all. If your organization is not on this list, please put it on.
Just a funny random note, Joe, somebody this morning told me about the Spirit program for the first time. And I was like, what's that? And they were telling me about peer-to-peer. And they were also telling me how they learned mental health first aid. That's something I've done myself. And I think it's just the most excellent thing. If you've never done it, I highly recommend. It just really helps in those stressful situations.
Oh, that's so good. Spirit, I'm all about Spirit. I'm like, I keep telling everybody, even the system workers should just like take the course, jump in the course real quick. I think it's great. Peer-to-peer all day long.
Morgan? So I was just wondering, I mean, we only have like 15 minutes left. Should we talk about the possibility of field trips? And also I have some things to share out just in the, for the good of the order kind of thing. I can go ahead and post flyers to chat, but just want to alert people to things that are going on.
Yes, go ahead, Maureen. So I don't know what we were thinking of about field trips.
Should we
Yeah.
have them?
Should we have them?
Where should we go? How often?
Should we have them as an HVAC group? Should we have them between agencies? I like field trips. I go on field trips myself. So
And are there specific things we want to get out of the field trips? What do we want to? What do people want that they can get from a field trip?
I'd love to see other food sharing things. So if people have pantries, maybe the food bank, that sort of thing.
I'm trying to share.
go ahead, Betty.
Okay.
So how about going for field trips to the entry point facilities, like go to GRIP, meet the staff, go to Trinity
Yeah.
House, meet the
Yeah.
staff.
That'd be good.
That's a fantastic idea. And that actually would facilitate knowing people at the entry points and having a person there. Mm-hmm. That's fantastic, Betty. And
Could even
also,
do one going to the crisis center for 211.
yeah, and understanding how it works. What happens when I walk into one of those facilities? What happens at the site? What do I need to bring with me, or what kind of things are they going to ask me?
The 211 Crisis Center, they give wonderful tours. Like they encourage us to go in there and take tours. They have this whole this whole skit. They'll take you around and they'll show you stuff. It's amazing to go into the crisis center and see what they do in the dispatch section.
I'll also mention part of what we're working on in the equity committee under that Council on Homelessness is sort of an educational campaign around like basic flyers. But one of the things we want to do is build some short videos that literally track somebody as they walk into a care center. What kinds of questions did they get asked? What does it look like? What can they expect when they go in? Because a lot of people want to know what goes on. So I'm just capturing on the jam boards. We have food distribution sites, care centers, crisis center.
How about the actual shelter? One that's in Concord, Martinez, Pacheco, whatever that's called.
Are there workforce sites that people want to see? Are you just interested in homeless?
Could go the one stop.
Sorry, I'm having trouble getting all these flyers I've been saving, which is attached to something on my calendar, into chat. I think I have to save them off my calendar onto something and then I can paste them
Correct.
into chat.
So the one stop is a job center, like a career center. There's San Pablo, then the one in Concord. I guess they call it AJCC in Concord now. There's definitely a one stop in San Pablo. Someone's field trip idea was a brief shadowing experience, hands-on experience, helping 1 or 2 people while on site. Someone else said going and volunteering at the food bank, which is actually one of the best ways to get to know people is working with them and volunteering with them on a project. It really creates collaboration. Richmond Works.
So St. Vincent de Paul, they have regular work training. They have like a whole thing that they give training for. And I think that would be a really good like tour to take to look at how they run this. Yeah, I think that'd be really good to visit St. Vincent de Paul workforce.
Yes, I got a tour last week. Sorry for jumping in, but I got a tour last week because I'm mentoring someone there and I was amazed. That would be a good one. And since I grabbed the talking stick, Jamie, could you plug your workforce training on 9/11 for the providers?
Yes, I will add a link in the chat. We will be having a training about workforce services. And I'm going to put the link in the chat. It is on September 11th. And I'm going to put the link in the chat. You can register for it. Tell all your friends. Okay.
And let me see if I can remember the lineup of trainers I booked. So Lau Family Community Development. So there's West County one. And then Opportunity Junction, I think, for East County. And I know the Senior Employment Program, Senior Community Service Employment Program. Oh, and then Metrics Online Learning, e-learning portal, free. And then there's another one, but it's a really good lineup, a lot of information. I was able to just drop into chat a flyer for a career and resource fair coming up soon. I'm not remembering the day. I'm trying to open it to see it.
I think it's in 2 weeks on a Thursday.
Yes, Wednesday, August 23rd from 10 to 1. Oh, at Pittsburgh Adult Ed on Stoneman.
And Maureen, if they don't make it into the chat, if you send them to me when I send a follow-up email, I can attach them.
Okay.
So this workshop, Jamie's virtual? When
Yep,
you just
it's on
posted it?
Zoom. Yeah, it's
Okay,
on Zoom.
great.
And
Thank you.
as with all of our COC trainings, we record it and then we send out and make available the recording and the slide deck.
I also just dropped a job announcement for a canvasser, a nonprofit called Human Rights Music is hiring. I don't think it requires any, they're a very cool organization. I don't think it requires any experience. And also BART is doing an on-site recruitment.
Maureen, I'm not seeing them showing up in the chat. Are other people seeing them?
No.
I'm not
okay.
seeing them.
Okay,
Okay.
it might just take a
Wait a
while for
minute.
them to upload.
No, wait a minute. Let me try again. Okay. There's the canvasser one.
There we
Oh,
go.
okay.
Okay, there's the BART one. Oh, that's actually at the Career Center, August
So-
30th. Okay.
I'm curious, like I saw some chatter about having sort of case conferencey time together, and somebody said like do these meetings more often. I know these meetings have traditionally we've had like here's a speaker and we've taken most of the time with presentations and speakers. Do we want to think about for the next one, which is I think it's in November, doing something more like this where it's kind of problem solving? I don't know. Just to help us think about the next agenda. So Maureen and Morgan and I aren't scrambling.
Yeah, I think so. Maybe we need to alternate presentations and problem solving. And I
Well,
just, sorry.
oh,
Go
go
ahead.
ahead. Just for me personally, having these open conversations, I learn more. I tend to obtain more because it's more personal. In a small group like this, being able to just bounce back and forth in discussion is very useful. I also want to make an announcement too, but I can wait until Maureen's finished.
Okay, sorry. I just dropped another thing into chat, and it's the Career Center calendar for August, a list of the workshops and programs and events and so on. Go ahead.
Oh, I am conducting a research project on behalf of Delta Peers, and similar to the outcome of the Constitution of Intent, it's gonna the outcome is just going to be amazing. But the research that I'm seeking, I think that the system workers, if any of you are interested in having a conversation with me, I would love to get your perspective on your job and around prevention work and homelessness, and even the bottleneck of 211, and just kind of bouncing off of, like I said, I'm doing a research project. So if anybody's interested, let me know. I'm going to drop my chat or drop my name in the chat. And then if anybody's interested, I'd really appreciate it. I would think maybe like a 30-minute conversation and just to brainstorm some things.
That's awesome, Joe. I'd be happy to talk to you. Or I could connect you with some of our case managers if you're interested. I'm going to put my email right here for you. Also, Hope Solutions is hiring for an employment or education and employment specialist for our TAY program. They're a fabulous, fabulous group of people. So it's a rapid rehousing program, and they're looking for someone to support clients finding employment or really getting them on an education tracked trade school so that they can earn a livable wage and sustain housing. So you can go to our website, hopesolutions.org. That's my announcement.
I don't think I have any.
All right. Does anybody want to add anything to wrap up or have any comments on the next HWIN meeting or anything like that? Because otherwise we can break up. Maureen, Jamie, did you guys want to add anything?
Oh, well, so Jamie, I asked you about the notes from the last meeting. Were
Let me
there
see
any?
if I can see where they are. Trying to remember.
Did they go out and I just missed it?
That's a really good question. I don't know that they went out with the agenda. This is the hard part with quarterly meetings. Feels like 30,000 years ago.
Yeah.
It was in May. I don't think we sent them out, but we can. So we can send them out after the I don't know if I can add them here. Let's see.
Okay, that'd be great. Thank you.
See if I can add them here in case anybody wants them. Hold on, give me a minute. Any folders? Okay.
All right, well, Jamie's going to send out the notes, put a link to the notes. There's always the videos are posted to watch again and share with your friends on Friday nights. And thank you everybody for such a really amazing conversation. Whether we solve things or not, it's really important to connect and come up with new ideas. And we've got people here that are listening. you know, that have voices in different systems and programs, but also just to know that like, yeah, we're all experiencing the same thing and we're all trying really hard. But I hope everybody enjoys the rest of the summer. It's already August and
What the heck?
it's going to be fast. But have a great day. Thank you so much.
Thanks, everyone.